Mental health is one of the non-communicable diseases which affects many people in the world, including Malawi. Unfortunately, 75% of people with mental illness in Malawi do not access mental health services. While mental health is part of the primary healthcare system in the country, service provision remains severely underdeveloped due to acute material and technical deficiencies within district hospitals and health centers. In response to this outstanding challenge, YONECO and Tackle Africa, with support from Comic Relief, are implementing a project called Passing and Supporting, building tactics for community mental health provision and care. The project is aimed at increasing access to mental health care services among Malawians and promoting social integration of persons with mental illness.
The mental health project that we are implementing in 3 districts of Zomba, Lilongwe and Kota. Of course, we have some programs which are national, like radio programs and the like. But the overall objective is to increase the mental health care services to the people, but also to ensure that we promote social integration of those who have mental problems at community level.
The project is employing various innovative interventions to reach out to people living with or at risk of suffering from mental illness. A very good example of such initiatives is football drills, which are used to sensitize communities with diverse messages concerning mental health. At the helm of the messages is the need to deal with stigma and discrimination against people with mental health challenges. Mavuto is a primary school teacher who once had a mental breakdown due to marital disputes which led to divorce. YONECO and Tackle Africa intervened at a very crucial time in his life. They introduced him to football drills which subsequently helped him to overcome the mental problem that he was facing. Football drills saved Mavuto's life.
There came a time when my first marriage was not working, and after official divorce that the court qualified, I failed to accept that my marriage was finished, and I started to worry a lot, which made me stressed to the point that I was not eating. It became so bad that I started thinking about killing myself, but luckily at that particular time I was called by YONECO and taught football drills, but also I was able to discuss issues regarding mental health.
Apart from football drills, the project is also economically empowering mental health survivors through Village Savings and Loans (VSL). MacDonald is a proud beneficiary of the VSL intervention. He managed to buy a pig using his profits from his VSL group.
I bought one pig, which I took care of. As I'm speaking, the pig is expecting, and I'm expecting to get a lot from the pig farming.
Among other things, the project has managed to increase access to mental health care services by the poor and marginalized. Chisomo, a student at Mtentera Community Day Secondary School, is such an example. His mother testifies of how the project has impacted the life of her son.
Honestly speaking, YONECO has helped me a lot because my son has changed. He was very troublesome around the house most of the time. He was causing trouble. After YONECO gave me guidance to take him to the hospital, things have changed. It is safe to say that his bad behavior has stopped.
Kota is one of the districts with a high number of mental health cases registered at the district hospital. Following advocacy done through the project, the hospital, together with YONECO, are working together with specialized clinicians to help deal with mental health issues.
YONECO is giving us a hand and is helping a lot to reach to our clients. One of the issues that we are engaging with YONECO is mental health awareness. Knowledge is power. If people are able to know, they are able to appreciate that other people also are faced with these mental health issues. So it has helped to reduce discrimination, stigma in our communities. As a district, we are trying our best. We are engaging our partners so that maybe we can reach out to them. YONECO is also helping us to provide care and reach into their communities.
A person suffering from mental illness is a human being as anyone else and deserves to be handled as a human.